As far as how much it costs, it varies from region to region. I'm blessed that I live in the Midwest and practice in Chicago, where it's a mandated state. So a lot of insurances here actually do cover egg freezing. Anu, who's also a fertility doctor, I think may have a different experience.
Yeah, so I'm Anu Kathiresan. I'm a fertility physician in Houston at a practice called Center of Reproductive Medicine. And so it is not, unfortunately, not mandated in Texas. And so costs can vary clinic to clinic. I would say it's typically in the ballpark of at least like $10,000 or so. And that usually doesn't include the cost of the medications. And then I would echo what Rui said also with the duration. So there's limited data on that, but from what data we do have, there hasn't been shown to be a difference in eggs that have been stored for a longer period of time versus a shorter period of time. So from what limited data we do have, we do usually say that we have no reason to think that the egg shouldn't be good for a long period of time.
All right, awesome. I'm going to go into the next one. Could you elaborate more about cost? So I think Anu mentioned that it's going to be around 10,000 plus the cost of medication, which will be, in my experience, was around 5,000. And so, I think just depending on whether your insurance covers some of it. And actually, I froze my eggs way before all the state mandates came in, and I was surprised that my insurance actually did cover some of the cost. So I actually only ended up paying for my medications. And I paid like $1,000 for, I think, anesthesia. But some of the other costs were covered even before New York became a mandated state as well. So I'm going to go on to the next question, which is, how old is too old to freeze eggs? Anu, do you want to start with this? Then we can go to Ruhi.
So yeah, also a difficult question to answer. It's always best to freeze eggs at a younger age versus an older age. The advantage of freezing at a younger age is that potentially you'll have more eggs of better quality. And then at an older age, potentially less eggs of lower quality. So if you wait till you're older, there's the possibility that you may need to do multiple cycles in order to get more eggs to get a comparable by birth rate as you would if you had done it, at a younger age. So generally speaking, we say a good age to start considering it is around 30 to 37, somewhere in that range. So that's usually, how I counsel patients about that.
Ruhi, would you agree with that?
I definitely agree with that. I'm also an eternal optimist. So I tell my patients, if you're ever thinking about freezing it, your next question shouldn't be you're too old, because that means you're in a position where you're not ready to have kids. And by the time you may be, you're going to be older. So younger, like Anu said, younger the better. Medically, the most 37 is the age that most people, when they freeze them at that age, they end up using them, whether it be for baby number 2 or baby number 1. Because when you look at the data, they don't have, kind of like you said, by the time you meet somebody, date someone, get married, you're already 2 years in and you're closer to that 39, 40 mark where the live birth rate really drops.
Right. And I think I'll just throw in a comment here, because I know me and you, Ruhi, have talked about this before, that sometimes if you freeze, I don't want to say too young, because I guess there's really no too young to freeze, but if you freeze your eggs in your 20s, of course, they're really likely to have much better quality. But at the same time, like Ruhi mentioned, like you may then meet someone and have kids naturally, and then you still have those eggs. So I think that thinking about it in your 30s is definitely a really good time to really think about it. All right, so Ruhi, do you want to take this one? Then we can have a new comment as well. How many eggs should be optimally frozen? I have DOR and have 9 eggs from 3 retrievals, debating doing another. I am single, so I'm currently egg freezing only.
It's a good question. We can talk for hours about this. So the more you have, the better. If it's feasible for you, I would say more. There's some data to support that with a diagnosis of DOR.
Can you elaborate on what DOR is for anybody that
doesn't? Yeah. So for those of you who are wondering, DOR stands for diminished ovarian reserve, meaning your egg reserve is much lower than it should be for your age. And then it's like kind of picking, this is the best analogy that I tell my patients. So imagine picking people for a baseball team, right? You're recruiting people. You're going to pick the strongest, the best, the fastest players. Just like that, our body picks the best eggs first. So when we're kind of dwindling down to our final few, the rate of abnormality may go up, meaning abnormal egg development, abnormal implantation, and chromosomal abnormalities like Down syndrome and trisomy. So if you're DOR, you're at increased likelihood of that, so you want more. In general, it's about 10 to 15 eggs for 80% chance of one live birth. There's a paper that showed that 20 eggs yields an 80% chance of one live birth and a 50% chance of a second live birth from the same set. Once again, most of this data is from cancer patients, not from patients who have done fertility preservation just for reproductive aging. It's more so for oncofertility, so we don't know if we can extract that data to regular fertility preservation, but in general, I say 10 to 15. With the diagnosis of DOR, if it's financially feasible, then I would say more.
And Anu, do you want to take the next one? Any major side effects on doing egg freezing?
So some of the side effects, like when you're doing the injections, some local bruising, that type of thing, your ovaries are going to be larger than you're normally used to. So it's going to be normal to have the abdominal discomfort, bloating, those type of feelings. So sometimes when women have a really good number of eggs starting out, their ovaries can get really big and they're at risk for a condition called ovarian hyperstimulation syndrome. And we do our best as fertility doctors to really choose the medication dosage carefully to help minimize that risk. There's a special trigger we use called a loop run trigger to also help minimize that risk and basically kind of shut down the ovaries after the trigger. So we do our best to minimize that risk, but that's also one of the main risks. And then the egg retrieval itself is a surgical procedure. It's minor on the spectrum of surgeries, but so there is going to be some risk of bleeding and that type of thing afterwards. But overall, it's pretty much like 1% risk for any complications really from that.
All right, awesome. I missed a question here. I'm just going to read it. Hey, Dr. Nagori, thanks for sharing your story. Anytime. I have a question about viability of eggs. I heard that if it's an embryo, there's a higher chance of success compared to eggs alone. And also, I wonder if you've ever thought about surrogacy and egg freezing. So I will take the last part of that and then hand it over to our REI specialist for the first part of that question. So I have thought about surrogacy and egg freezing. As you guys know, which I shared earlier, I am married now. And again, I'm going to have these guys come in and correct me, but surrogacy, if we're getting technical, means that you're actually using the egg of another woman versus gestational carrier, which we would actually use our own embryos, mine and my husband. So right now we are 3 months post having a baby, and we want to have 3 kids. I'm 38 years old, so we have actually thought about going ahead and freezing embryos in the next 6 to 8 months once my period comes back. And the reason for that is, a couple reasons. One, I have been advised to not get pregnant again, at least to wait a year between pregnancies. And then obviously I'll be 39 and the eggs are going to be older at 39. So we thought, hey, if we go ahead and freeze embryos in the next 6 months, we'll have 38-year-old embryos. And then we're not like in this panic to have another kid, which could be potentially unsafe for me and risk of like uterine rupture with just having a C-section. So obviously trying to wait. And then if we wanted to have a 3rd kid, again, if you account for me being pregnant and then possibly nursing, that's another year goes by and a 3rd kid would, just wouldn't even be possible until I was 41 or 42. So we thought if we had those embryos, then potentially if we wanted a 3rd kid, a gestational carrier could be an option for us if I'm not able to carry in my 40s. So we have definitely thought about it. We may be freezing embryos in the next 6 to 8 months to keep the possibility open for a 3rd child. But definitely something we've thought about, but we haven't considered surrogacy in the sense that it would be a donated egg from another woman. So I'd honestly just defer to Ruhi and Anu on the terminology here. And then Anu, if you want to also take freezing embryo versus freezing an egg?
Yeah, so freezing eggs generally, so an egg is a one-cell structure, and so it's kind of more fragile compared to the embryo. The embryo is several hundred cells. So once you have an egg and you put the egg and sperm together, it becomes an embryo. And then we allow that embryo to grow for about 5 to 6 days, and it becomes a blastocyst. So at that stage is when we do genetic testing. It's called PGT, pre-implantation genetic testing. And so then we can get the genetics of the embryo and know if it's normal or not. So it's not, I guess, we just have the ability to have more information if we have an embryo versus the egg. So yes, if we've frozen, 9 eggs, 10 eggs, we just don't know about the genetics, whereas with the embryo we do. So that's the advantage of the embryo versus the egg.
And you just comment on terminology too, surrogate versus gestational carrier. I'm not sure if that was correct or not, but that's what I've been told.
Oh, sorry, for me. So yeah, surrogacy. So in conditions where patients have like uterine abnormalities, like let's say severe, fibroids, adhesions. So surrogacy is essentially if a patient has those conditions, using someone else's uterus essentially to put the embryo back in. So if a patient wants to, if they don't have a uterus that's able to carry, then they can create their own embryo and then put that embryo into someone else's uterus. And so that other person is the surrogate.
And then Ruhi, do you also want to comment on egg versus embryo, if there's anything you have to add to that?
Yeah. So there's this I actually learned being a patient, that you don't actually learn, like they tell you, but you don't realize it until you actually go through it, that there's a big attrition. So if you freeze or if you extract about 12 eggs, there's an 80% maturity rate, meaning not all of them will have completed separating into just half of you. And then out of that, only 70% will survive, fertilize. So say out of the 8, now you have 6. And out of that, 50% will have the genes to then develop into a blastocyst, meaning separate into baby and placenta. So you see that big drop right at the front. So when you freeze eggs, if you freeze one egg thinking that one egg's going to be an embryo, it has to go through its stages and it may not be able to. And that's why more eggs, the better, because then they can go through those stages. Another thing that you're adding when you're freezing eggs is thaw survivability. So not because, like Anu said, they're single cell structure, although they're the largest cell in the body, they're still very small. Not all of them will survive the thaw. So blastocysts, which are a cluster of cells, are bigger. So their thaw survivability is anywhere from 95 to about 99% versus egg, which is about 80%. Some clinics are at 90, but that's very recent. Previously, we weren't even good as that. So you have to think about thaw survivability and the attrition, and that's why you need so many eggs to then become an embryo. And then I'll comment on real quickly, if you are freezing your eggs and if for some reason you think you'll need a surrogate in the future, you want to, it's really FDA regulated. So all of my egg freezers, I always FDA test them and I do an FDA physical on them before they freeze their eggs, because that way you're able to put those eggs or that tissue then in a third party, or even if you don't use them, then donate them. It's very FDA regulated and it's very Republican almost regulated. So you have to have a reason. So I have to sign off on a reason why you can't carry and why you need somebody else to carry. So it has to be you don't have a uterus, or you have like, say like Saya said, if she has like a medical illness like high blood pressure or HELP or something, that then you're using somebody, or implantation failure or recurrent pregnancy loss, then you can get it. It's not, oh, I don't want to carry, so here I'm gonna get a surrogate. It has to be something that medically says that you need a surrogate for, like I said, or not having a uterus. I know, would you agree?
Yes, I agree.
All right. I was in another question. I was in the process of having the workup done, and then COVID happened. Are there any studies that COVID can affect these eggs? Should the process be postponed? Anu, do you want to start?
Yeah, so it's still with COVID, very limited data, a lot of unknowns. So for what data we do have, I'm not aware of honestly anything that's specific to eggs. More data on outcomes if patients are getting, if they're pregnant in the third trimester and getting COVID and that type of thing. So I would say for right now, we don't know. And for patients that are considering egg freezing right now, we're still proceeding with treatments. We're counseling our patients to be very careful in terms of COVID exposure, to practice, the mask, the hand hygiene, the social distancing, staying at home, taking all precautions that they can to avoid exposure or getting it as much as possible. If they do get exposed or anything of that nature, we cancel their cycles because we also don't want to take any chance for them or for us as a clinic and our staff. So yeah, that's how I'd answer that.
Ruhi, anything additional to add?
No, I would say that's very true. So if you're egg freezing, if that's what we're talking about, besides, like Anu said, if you get COVID, then we cancel more for our staff safety and also your safety, so you rest up and recover. But in general, there's more data on sperm and COVID because sperm is like a stem cell. It has the ability, it matures and grows in the body versus an egg, which is created pre-conception. So it doesn't hold antibodies. So you don't have to worry about if I get COVID or if I had COVID, is that going to latch onto my egg and then re-enter my body if I end up using it? Versus sperm, it's debatable, and there's studies that go back and forth on that.
Okay, awesome. I have a personal question as well. Now that I have two of my favorite REIs to ask questions to, so I froze my eggs in New York, and I've heard like varying things about going up to New York to actually fertilize them versus like having them transported. What's the deal on transporting eggs? Like, is it like better for the egg if we go to them, or is it okay for the egg to come to us? I'm in DC now.
I mean, I would say either is okay. Right now, in the climate of COVID, I would worry about you traveling up there. So I probably lean more towards shipping them here. I think that shipping embryos is a little bit more, just again, because the embryo is more cells, more robust. We are a little bit more comfortable with freezing or transporting embryos as opposed to eggs, but I would probably consider more transporting the eggs. I think that would be what I would recommend.
Yeah, and like, what do people worry about when they're like transporting eggs? Like, just it thawing, or like what? Yeah.
That basically, if there were to be any sort of issue with the liquid nitrogen and any slight thaw that might happen to the eggs. Yeah.
Now, is it something that like I can do, or does the clinic have to do it? Like, can I go up there and like get at my cooler? Like, what?
Yeah. No, so they have special third parties that they involve to do that because we want to make sure it's done as safely as possible. So yeah, someone else would be doing it.
I can't like put them like in my cooler next to my like beer and like sandwich and like take my eggs. Okay. Any other final questions? We have about 60 seconds left. Okay, this is a good one actually. How do we find out if our state is mandated? Is mandated a term that pertains to egg freezing or IVF, or are they both in the same blanket? This is a great question to end on because I think this is a great action item for people to go find out if their state is a mandated state.
So you can go and see which states cover fertility. There's about 16. And to find out specifically, because even in Illinois, not all insurances cover egg freezing. It's certain companies who don't differentiate.
Okay. And Ruby, what's the website, or just Google?
Just Google, yeah.
Okay.
If you say fertility coverage by state, there's a list of 16, and then it also varies on companies, because even if you don't live in a mandated state, but you work for something like one of those techie companies, a lot of them, Starbucks for one, covers everything.
Oh, nice.
Yeah, sorry.
I love that you can hear the kids. Sorry.
All right, great. So, Ruhi, Anu, like any final words for our almost 70 participants that are live here, interested in this? Anu, we can start with you and then finish up with Ruhi.
Well, first, I wanted to say thank you to Saya for sharing your experience. I think that it's something that's sometimes taboo to talk about, and I think it's good that we're putting it out there more and talking about our journey and experience. And then I would just encourage women, if you're thinking about it, to just get more information. Go to a fertility clinic, fertility doctor, just to learn more about what happens with our advancing age and fertility, perhaps see where ovarian reserve stands right now. And then you can make decisions, with more information. And it's always better to kind of have more information and act on that versus time, passing and time making that decision for you and then potentially having regret later down the line. So yeah, I would just say consider getting more information if you're considering it.
And Ruhi?
I agree. I think it's always good to be proactive. And Saya, thank you so much for sharing that. And I think that's what you described is a very true feeling. Like you're anxious, you're scared, and it's very different from IVF because you don't necessarily need it. So that hesitation that you had is so valid. And you see so many patients struggling with it. So it's completely normal. And I think actually starting it, you realize, like you said, hey, it wasn't as bad.
Yeah.
But definitely ask your company, even if they don't have coverage, they have a lot of like those HSA plans or will cover some of it because they are vested in your future and they want to keep you there and keep you happy. So I've been noticing a lot of companies have been saying, well, we'll give you some money to get it covered or we'll pay for your meds. And I think that's really good.
Yeah, and I totally agree with that. I think that like IVF, like that, I just think that's probably, I mean, I like luckily haven't had to do it yet, but I think that that's just a different journey. And again, like egg freezing for me, and again, not to say that it's going to be easy for everybody. I did have like a lot of skin issues afterwards and like some like cystic acne that eventually went away after a couple months, but overall it wasn't as bad. I'm also a very anxious person, so like I felt like maybe my anxiety was worse than other people's leading up to it. But I think overall it's like, it's something that if you're really considering it, get the right information, um, and have a support system. And you can find all of us, all three of us online. And yeah, I think everything that was said here is dead on and spot on. And I wish I had something like this, honestly, 5 years ago, because I probably would have done it way before I was 34, because I first considered it at 32, and eggs are younger. So I wish I had something like this 5 years ago.